topics that folks want to hear about, and we heard that there is a need and a desire to learn more about the youth vaccine for our littles. So that's what today's session is all about. I'm gonna hand the mic over to my Keisha, and she will get us started today. But thanks everyone for being here.
Good morning. We are very excited for you to join our conversation today so we can be able to answer your questions regarding COVID-19 vaccinations for your youth. We are going to start with our introductions. Our first introduction is Ms. Stephanie Charles. She is the Director of Nursing at Covenant Living and an infection preventionist. She's also a consultant for Grand Rapids African American Health Institute. Welcome, Ms. Stephanie Charles.
Thank you.
Thank you.
This meeting is being recorded.
Our next person that we have that we're really excited about is Professor Laura Moody. She is on vacation and she thought this was very important, so she is on our call today. She is the professor at Grand Rapids Community College who has helped thousands of students become nurses. She's a part of the Black Nurse Association and she's on the board of Grand Rapids African American Health Institute. Good morning, Professor Moody.
Good morning, and I will say I am a retired professor at this point, so
Yes.
I'm still working. You think I'm not retired, but good morning, everyone.
Thank you. Our next person that we have is Dr. Mathis. She is an OBGYN. Dr. Mathis graduated from Michigan State University. Dr. Mathis completed her residency at Grand Rapids Medical Education and Research Center. Dr. Mathis has more than a decade of experience in obstetrics and gynecology. Her areas of interest include abnormal menstrual bleeding, pelvic pain disorders, and minimally invasive gynecological surgery. Good morning, Dr. Mathis. Thank you for joining us.
Good morning. Thank you for inviting me. I'm very happy to be here to help answer any questions from the gynecological standpoint and maternal care questions specifically regarding COVID.
Thank you.
Yes.
We're going to have our Grand Rapids Public School nurse go ahead and introduce herself.
I'll start. There's a few of us. My name is Kim Barron. I'm the Director of School Health Services for Grand Rapids Public Schools.
Thank you.
Mm-hmm.
I'm Kirsten Wade. I'm the nurse supervisor for Grand Rapids Public Schools.
Thank you. And then our next is Dr. Bora. May you please introduce yourself?
Sure. Good morning. Thanks for having me here. I'm Neurological Bora. I'm a family physician, medical director at the Kent County Health Department.
Thank you. So we are going to dive into some questions. So our first few questions that we have gotten from the community is, why is it important to have my child vaccinated is the first question. We're going to start with Dr. Bora.
Sure. So I could talk for 2 hours about this, but I will limit it to just a couple minutes. But there's so many reasons to have your child vaccinated. I think first and foremost is to protect your child. We know that COVID can cause long-term symptoms. It can cause severe symptoms in some children. About 2% of local children who get COVID end up being hospitalized. Children can die from COVID, but it can also cause long-term side effects, even if they don't get severely ill. But things like difficulty with taste or smell long-term, changes in thinking, fatigue, all of these things that we don't want our children to deal with long-term. The other reason to, and then the other one is MIS-C. So there's an inflammatory response that can happen to children, even if they get COVID and it's very mild or they don't even have symptoms. They can develop a syndrome later on that can cause severe health issues. So these are some basic reasons to get your child vaccinated. The other reason is to protect the people around your child. So people who may be more vulnerable, who have other health issues in the family or friends who may be elderly, who have a suppressed immune system for different reasons, having them get COVID could be very dangerous for them. So protecting your child protects not only your child, but also your family and friends and everyone else that your child comes into contact with.
Thank you. Professor Moody, would you like to answer that question from a healthcare standpoint?
I guess look at what I've been seeing lately, and even talking, like Dr. Boris said, we're all on these calls together. But the main thing is that with our kids and things, they don't want it because they're afraid we're putting something into the kids. So we have to make sure that we're letting them know that, no, it's important that they get it. Because even looking at, like you said, from a standpoint of death, my husband's a mortician, and we're seeing younger and younger people that are dying. So it's real important that they take advantage of the vaccine. So we're really pushing that.
Thank you. Ms. Stephanie Charles, if you don't mind answering from a nursing home standpoint and how that affects your patients when we don't have people vaccinated, and why is it important for your population to be vaccinated?
Absolutely. I think it's all relative, everything that both of the ladies already spoke on applies here in long-term care. We do subacute and long-term. If people are coming in, these are very vulnerable people. I work with a very vulnerable population. People are coming in and not vaccinated, then we're putting our residents, our elders at risk. So even for people who don't qualify to have the vaccination, as our children become vaccinated, that helps protect them as well. So that's why we are pushing, we are recommending for visits even into the facilities. Of course, we do not mandate it, but we prefer that people are coming in and are vaccinated to keep our facilities safe.
Thank you. Ms. Kristen, from a school perspective, what is the guidelines for the school when it comes to vaccinations?
Sure. So there's no requirement for students to get the vaccine, but we are obviously encouraging it as public health professionals and working with pediatric populations. So we are, all of our nurses in our district are trying to provide the most up-to-date information regarding the vaccines and information about where they can go to get vaccines. And we did partner back in this November and December, we partnered with Cherry Health actually to offer some COVID-19 vaccine clinics at all of our elementary buildings. So that was one way we just tried to get more people involved, more people vaccinated.
Ms. Kim, do you have anything to add from the school perspective?
I think to respond to your question about why we think it's important, what we do know is that vaccinated children often have less severe symptoms, fewer symptoms, which will result in fewer days missed if they do test positive for the virus, and also limits the number of days that they would have to quarantine or be recommended to quarantine if they had an exposure in school. So ultimately, just limiting the time of educational time in the seats that they would be missing.
Thank you. Dr. Mathis, from your perspective with your population, why is it important?
I have a population of all ages. I have some younger patients and I have older patients that are women. And I recommend the vaccination for all age women that I take care of, because everyone is over 7 years of age. And from a medical standpoint, it has been proven that the vaccination is helpful in preventing severity of disease. It dramatically reduces the risk of being hospitalized due to the coronavirus itself, and also, of course, death, as already everyone mentioned. So I agree with what everyone has said so far, but from a young women's standpoint, since I see a lot of young women, it's very important. We recommend vaccination because we can also see when young women get pregnant, they automatically become immune compromised. And with that immune compromised status, the coronavirus can be even more severe in those patients than in any other patients. So because we have seen, unfortunately, in all 3 hospitals in town, severe coronavirus impacts on women, pregnancies, and their babies, we all recommend the coronavirus vaccination for all of our patients. And so from the child standpoint, I recommend that the children who are eligible for the COVID vaccination receive that as well, because if the child is going to school and comes home to their family members, I agree that that also is a risk factor to the family and everyone who's in that household.
Thank you. Dr. Boer, we're going to come back to you with the age that people and children especially are able to get vaccinated, and talking about the specific vaccination.
Yeah, so this slide, I think, has a great overview of it. The children, everyone 5 and older, are eligible to get the vaccine, and we would recommend that all children 5 and older do get the vaccine. The booster is now approved for children 12 and over, so we would also recommend that for those children. In terms of the younger children, we still don't have a final idea of when that vaccine will be approved. We're hearing March, maybe late March, that a vaccine could be approved for those that are 0 to 4 years old.
Thank you. So do we have any questions in the chat at this point? Ms. Katie?
I don't see anything yet, but
Okay.
as a reminder to everyone on the call, if you do have a question, you can feel free to put it there and I can relay it to our panelists.
Okay, and just going back to vaccinations, if my child is vaccinated, do they still need to wear a mask? So Dr. Boer, do you want to start this conversation?
Sure. So, with the Omicron variant and with others, we are finding that even those who are vaccinated can still become infected and can still pass on the virus to other people. So they don't get as sick as people who are not vaccinated, but they can still become infected. And so for that reason, we do still recommend that even though people are vaccinated, they still continue to wear a mask. The other piece of it is that the less virus that you're exposed to, the fewer your symptoms will be. So they're finding that people who are wearing masks and get COVID are still less likely to become as ill as those who are not wearing masks. So not only does it help protect the people around you, but it does help lessen your likelihood of getting as sick.
Okay. So with the nursing home standpoint, Ms. Stephanie, what is the recommendation within that population related to masks? You're muted, Ms. Stephanie. And while she's getting herself unmuted, we can ask from the school perspective, what is the guidelines around that related to masks?
I could take this one. So in the Grand Rapids Public Schools, we are still enforcing universal masking for all students, staff, and visitors at this time. We just felt that it was important to protect those who haven't gotten vaccinated yet. And just because there is so much prevalence of the virus popping up in people who are even vaccinated. So we're still requiring masks for everyone.
Okay. Thank you.
And as we are, this is Stephanie, we are requiring masks in our facilities as well, regardless of vaccination status. So we are encouraging even our residents, the ones that are eligible, to become vaccinated, but any visitor, any vendor, any staff that is in the building must wear a surgical mask. We are not even accepting at this point cloth masks.
And
Just
from
to-
go on, sorry.
ahead.
I was going to say, just from the medical standpoint as well, every office, like the Mercy Health Physician Partner offices, as well as St. Mary's Hospital, and in fact, Butterworth Hospital, Spectrum Health Hospital, and Metropolitan Hospital are the same way. Everyone has to wear a mask. Everyone has to have a medical grade mask, not a cloth, no gaiters, nothing like that. And visitors are limited just to help reduce the amount of people who are walking through the facilities in all of the healthcare institutions in town. And that's all to prevent the volume of people coming through and the viral load that people are exposed to.
Okay, so we do have a question in the chat. And the question is, I have had every strain and did not have any symptoms or hospitalization. What would the vaccine do for me? So we're going to go right to Dr. Mathis. I'm actually have you start this conversation.
Sure. I've seen patients who've had both the Delta variant and the Omicron variant. And each time I've had that question as well. And we just don't know what's the next variant might possibly be. Hopefully we won't have another variant, but the chances are likely that we will. Most patients have some symptoms. So the actual person who chatted has a unique experience because most patients have had experience with symptoms with both viruses. That's how they knew they actually had it. But usually the predominant response patients have had has been that the Omicron virus has been much less symptomatic compared to the Delta type. So in general, because Omicron doesn't have as many symptoms, most people have less symptoms from that standpoint. I still recommend, because the CDC still recommends and all medical agencies still recommend the vaccination for all people, just because we know that if a person does get sick, the person will be less likely to be as sick, less likely to be hospitalized if they have the coronavirus experience again, because the actual independent strains do not provide the same immune protection and stimulation of the immune system to help fight off other variants. The vaccine, it has a much broader antibodies suppression effect than the individual variants. So I don't know which variant might come next. That person could possibly be affected by it. I don't know. I hope that they are. I hope nobody is. But at this point, since we know how much of a problem the coronavirus has been for many people, I would recommend that the vaccination still be obtained by a person who's had both the Delta variant and the Omicron variant in the past.
Thank you. Dr. Bora, are you able to answer this too from the King County's perspective of a person having both strands and not being hospitalized, and what the vaccine will do for them?
Sure, I agree completely with what Dr. Mathis just said. I don't have that much more to add, but I agree. I think we don't know what's coming next. There likely will be future variants, and we just don't know what they will be. And so this is a way to have some additional protection before we're exposed to whatever else will be coming next. And we know that this vaccine is incredibly safe. So there aren't the side effects that we would want to worry about. So we know it's a safe way to protect against future unknowns.
Okay, thank you. We're going to go right into these questions because we had a few questions related to what is actually in the vaccines. Dr. Bora, can you start us out with this conversation?
Sure. I believe there's a slide too, right? This is the
yes,
slide that you're showing exactly what's. So they have very few ingredients. They're just the bare minimum of what's needed to provide the protection that's there. So you can see in here, I think this is a really helpful slide. It says they do not have preservatives, which is something that I think a lot of people have been concerned about with vaccines in the past. And all they really have is basically the Pfizer Moderna ones just have the message, the recipe that your body needs to create that immune response. Your body will create the proteins that it needs. So people do talk about the monoclonal antibodies as a treatment for COVID. But what the vaccines do is they allow your body to make their own antibodies that are going to be effective. And so this is going to be a really healthy way for your body to naturally create the immune response. The Johnson & Johnson is slightly different. It uses a different virus to kind of deliver that recipe to your body. But it's, again, it's a virus that's been modified, so it doesn't cause any illness. And that's on the slide here as well. But basically it's the salt, sugar, and a little bit of fat to help that the recipe actually enter the cell, but very minimal ingredients in these vaccines.
Thank you. Our next question, I just have to slide up, give me 1 second here. So our next question is, as we know, there is so much information out there as a health professional. What do you believe to be the greatest hesitancy for parents getting their child vaccinated? And I'm going to start with the nurses from the school. What have you heard, or what concerns that we need to address today? So
I can start. So like this question said, there is a lot of information out there and a lot of misinformation out there. I think it's really hard to filter through it all to know what the best decision is for your child. I think people do hear a lot about the Omicron having less severe symptoms, so thinking it's not really necessary. And that, you know, it just, if they're going to get it, then they'll be immune. And there's just a lot of different, I guess, guidance that you can find kind of anywhere. And what we're trying to do is obviously make sure people are going to their physicians or other credible sources to get information. But I think, and there's just a lot of fear out there too of what's in it, or why bother getting it if I'm going to get sick anyway, and thinking the vaccine maybe doesn't work because they end up getting sick anyway. But we're trying to reinforce the idea that, you know, yeah, you might still contract COVID, but your risk of, as we've all said, hospitalization, death, long COVID, all those things go way down if you're vaccinated.
Thank you. Ms. Karen, do you have anything to add? Or Ms. Kim, I'm sorry.
I don't think I have anything else to add. I think Kirsten summarized it quite well.
Okay. Thank you. I'm going to have Ms. Katie, she's going to skip to our mask slide just because we do have a question specific to that. And I'm going to have Dr. Bora answer this question. The question says, I went to Spectrum for testing. I was wearing the black mask that looks just like the blue mask. I was asked to put on a blue mask. What is the difference in the mask?
So I think we just know more what's in the standard surgical mask. They're more standardized, so we know what kind of level of protection they provide. So I think it's just, there could be a lot of different black masks that they probably could work just as well. We just can't prove that for sure. So right now, you know, people are recommending that the N95, you know, those are typically used in healthcare and they need to be fitted properly, but there are a lot more of them that are affordable and available. So if people do have access to those, or a KN95 in the community, those do provide better protection than a standard cloth mask. For people who can't get to one of those, having a double layer of masks, so having a surgical mask and then a cloth mask over that. And the reason for the cloth mask is it helps provide a better fit around the surgical mask, which provides helpful for the filtration piece of it. So those are some 3 options that can be helpful for people if they're trying to think about what mask is going to be most effective right now.
Thank you. Mr. Kalon had a question that he would like to ask.
Good morning, everybody. Kalon, program coordinator here with GRAAHI. I have a specific question. I'm 27 years old. So based off the data that we're seeing 18 to 29-year-olds are the most hesitant to go in and get vaccinated. And what I'm realizing is that a lot of people are playing this waiting game with vaccinations because there are so many variants coming out. Can we speak to how we can kind of bridge that gap in conversation to where when somebody says, hey, I want to wait until they find a final vaccination as there are more variants coming out? My belief is that the virus is trying to stay alive, and we are trying to create things that can combat that as that virus is staying alive as well.
So we're going to start with Dr. Mathis because you have a great range of age in that category.
Yes, so I agree. There are definitely many reasons why people are hesitant about getting the vaccination, and it would be great to be able to predict what the next problem will be coming along. But as we have seen with the current coronavirus pandemic, the virus, just like you mentioned, has been changing and mutating to its benefit so that it can stay alive. The beauty of the current vaccinations is it's made to help fight against the particular spike proteins on the actual coronavirus. And that's why we found that there is protection from the current vaccinations against both the Delta variant that we had before and now the current prevalence of the current predominating Omicron variant. We suspect that probably it will continue to be helpful against other variants of coronavirus because it has a more wide-reaching effectiveness on different coronaviruses. So and that's why when a person has one virus exposure, so if a person had a history of Delta virus exposure in the past, we know that if you compare a person's immune system who had coronavirus Delta variant exposure in the past and had that illness, that person is still not as well protected against the Omicron virus in comparison to the person who's been vaccinated. So a person who has had the actual virus compared to the vaccination does not have as much protection. That immunity that they have developed from one variant does not work as well for other variants, whereas the vaccination has been more effective than being exposed to a virus variant in the past. Now, on the flip side, a person who has had the vaccination and who has had exposure and had the coronavirus infection is expected to be exceptionally well protected against future variants. So we've seen that with Omicron, that people who have had Delta variant exposure and had full vaccination tend to barely even know that they have an infection because of the fact that they have had exposure to all possible variants or a prior variant and also the vaccination. So to answer your question, it's impossible for us to really predict what's going to happen next. Like I said, I hope that we don't have a new variant that comes down the line, but the chances are pretty likely that we'll probably have another variant at some point or some other infection. So it probably will be helpful for anybody to still get the vaccination now to help protect them for the future.
Now. Yeah, gotcha.
Yes.
Yeah. Perfect. Thank you.
You're welcome.
So I'm going to ask this next question, and it's related to what Mr. Kalen just asked, and it's asking, why does the COVID-19 why does it mutate, and how does it mutate? And I'm going to ask Dr. Bora this question.
So anytime a virus replicates, there are going to be mistakes that it makes as it's trying to replicate itself. And that's when you start getting these mutations. And once you have more and more mutations, you get different strains and then different variants. And whatever changes that it makes, it helps it replicate, helps it propagate from person to person and transmit more. Those are the ones that are going to be selected for. Those are the ones that the virus will keep because it works. It wants to infect more people. And those are the changes that help it do that. So the more people actually that are not vaccinated, the more likely it is that the virus will transmit and replicate more. And so we'll get more variants happening in the future. And so we're seeing these variants because there are parts of the world that have not been very well vaccinated. And so again, the more people we can get vaccinated, the more we stop that transmission from happening, the less the virus replicates and the fewer opportunities it's going to have these mutations that all viruses naturally will make. And the other thing that you'd mentioned was like the waiting on the timing, just with how infectious Omicron is right now. I think the choice that people have right now is, do I get the vaccine or do I get Omicron? I think that's kind of the decision that people would be making at this point, just with how much infection we're seeing in our community right now.
Thank you. So we're going to go to slide 4 for Ms. Katie. And the next question that we do have is related to, how does the vaccine affect my child? So it should be slide 4, so it's right above this one. Yes. So what are the side effects for getting my child vaccinated? So we're going to actually go to our, we'll start with Dr. Bora, and then we'll talk to our school nurses.
Sure. So children get similar side effects to what adults get. We're finding that the younger ones tend to have even fewer side effects. If others have experience with that, let me know. But they may get a little bit of achiness of the arm, a little bit of swelling at the site of the injection. They may get a little bit of fatigue or a headache. Those tend to go away after 1 to 2 days. And that's usually it. And if they need to have something like Tylenol to help them, if they develop pain that's really bothering them, then that's fine too, to help them get through that.
And talking to our school nurses, Ms. Kim, Ms. Kristen, what is that? How do you prepare your child for the vaccination and the side effects? What are you sharing with parents?
I can take that one. When we went through our elementary schools with Cherry Health to offer the vaccine clinics, we just notified parents that that their children would likely experience similar symptoms to what they experienced, but like Dr. Bora said, children generally experience less severe, if any, symptoms. And just anecdotally, from our experience, it seemed as though that was exactly right. We heard from some families that kids had a little pain and redness at the injection site, but that was generally about it. Very few that complained of much more than that.
Thank you. Professor Moody, if you can kind of speak to this as well, how do you prepare as an adult to be vaccinated and some of those symptoms around that?
What I've seen and what I've been talking with different ones, when we did the shot of love, we found out that a lot of times they had the headaches, they had the sore arm, or just feeling tired for one day or so. But usually by that second or third day, they usually come out and they're feeling better. For the most of the ones that we vaccinated, several thousands of people, so they come out pretty good at the end. But again, everyone was different. No two people, even in the same household, had the same symptoms. So people got to know that you're going to get a symptom, be it a headache, be it a sore arm, be it tired, and some people don't get any symptoms at all. So it varies.
Thank you. Ms. Stephanie Charles, what does that look like in our elderly population?
It looks actually what Professor Moody just said,
Okay, I think that you're on mute, Ms. Stephanie. Okay. You're back on mute.
okay.
Okay, we're good.
I'm not sure what's going on there, but I was saying that just exactly what Dr. Moody said, the same with our population. They are experiencing either no side effects, no symptoms after, or just maybe some pain in the arm. That's been the majority of our residents. That's what we have seen. There have been one or two who have been very fatigued, but it's difficult to decide whether the fatigue is related to the vaccination or whether it's just part of their process in life. So same things.
Thank you. Okay, so then our next question, which we'll go to the next slide. What about it said it has been stated that the vaccine could potentially be available for 2 and up. With that, there are some patients that actually get myocarditis. What does that look like, and does it resolve? So I'm going to go to Dr. Bora for this question.
So for the myocarditis, it is a pretty rare, and make sure that I'm answering the question, please. I'll say a few things, but if I'm missing that question, please just let me know. So it is quite rare. In children 5 to 11, there have been about 12 reports of myocarditis, and children do tend to recover from this. And that's out of more than 8 million injections that have been given. In the 12 to 15 age range, there have been about 265 cases of myocarditis. And so that's the same inflammation of the heart, but that's in over 18 million doses of shots that have been given. So it's very rare. And what we are seeing is that children who have COVID are much more likely to get myocarditis as a result of the actual COVID infection. So again, the difference between the two is that the vaccine is really rare, but you can get it. With COVID, it is going to be a much more likely outcome of getting COVID is the myocarditis. So I hope that answers your question.
Yes, it did answer the question. We do have a slide about V-Safe. Can you explain about V-Safe and why that is important, Dr. Bora?
Yeah, so there's just very rigorous monitoring that is happening of our vaccines, of the COVID vaccines that are happening right now. So people will get texts so they can, if they have any symptoms or concerns, they can enter that into that. Also, all healthcare providers are required to report if someone is having symptoms or not feeling well. You can also let your doctor know, and they will report that. And that all gets put into a database that's being reviewed very regularly. So if the CDC or these organizations are seeing that there is an increase in a certain symptom or something happening after a vaccine, even something like appendicitis, maybe there's something connected, they will investigate that. So they're really trying to make sure that any signal of any kind of concern from a vaccine is taken very seriously.
Okay. And the next question talks about long COVID. If you're not vaccinated and long COVID does occur, how long is what the question is, or what is the period that you're going to have long COVID. So I'm going to go to Dr. Mathis, and then we'll just go down the line from there.
Sure, I'm not an expert at long COVID, unfortunately, but from my understanding, from what I've seen with it, long varies person to person. Some people have long COVID and it's lasted ever since they've actually had the infection, even if it were in 2020. But long COVID can also become, the severity also depends on the person. People just have a prolonged coughing interval of time. Some people have just prolonged fatigue. Some people have more symptoms like the loss of taste and smell that never come back exactly. There's just a variety of degrees of problems that a person could possibly have with long COVID. And what they have found is that patients who are vaccinated, the chances of a person having long COVID is less likely because they tend to have less severity of disease in general. So the duration of long COVID just varies person to person when it happens. And the hard part is we never know who it's going to happen to, because it can happen to a very previously healthy person or to someone who has several health problems or health risk factors.
Thank you. Dr. Bora, do you have anything to add to that?
Oh, I think Dr. Mathis did a great job with that. It's just so unpredictable. Even people with pretty mild symptoms may develop long COVID, and it could last years. The brain fog, the mood changes, there are a lot of different things that people are still learning. And I think clinics to help address, or health centers to help address this, are forming all over the country. So I think we'll learn more as time goes on. But again, that's why we do encourage vaccination, to help reduce the chances that someone is going to have to deal with that for a long time.
And Ms. Taylor said that she had a friend that had COVID in March 2020, and she has been diagnosed with long COVID. She still has it and treats it. So like you're saying, Dr. Bora, it is unpredictable. The next question that we have is again related to side effects, and asking, is there any neurological effects or side effects if my child gets vaccinated? So we'll go right to Dr. Bora for this question.
So the neurological side effects are very rare. I can pull up a slide in just a second to see they have looked at all the injections that have been given to children, and they've ranked all the side effects, and it's quite rare. But if you give me just a minute, I can pull that up and come back to that.
Thank you. So while Dr. Bora is pulling that up, again, if there is any side effects, we do need to report that in VSafe. So.
Yes, and we definitely encourage anybody who has unusual side effects after their vaccination, after the observation period, or after they get it, to definitely contact your doctor's office and let them know what's going on so you can be assessed about that. So, but it's very uncommon. We do give the vaccinations in our OBGYN office as well, because we would like to get all of our patients vaccinated if they agree to it. And we rarely have any complications that patients call back for concerns.
And then the question that I have is for Professor Moody, because when we talk about side effects, there's side effects for the immediate, and then there's side effects that might happen later. So Professor Moody, usually when we have vaccinations, is it immediate, and why?
And I think one of our doctors can add to this, but sometimes they will have that's why we have them wait that 15, 20 minutes. So if something's going to happen right there, so at the site when they give the vaccines and everything. But one thing I want to add too is that a lot of times some of the side effects, like the doctors are saying, they may not even know that it's a side effect. So I've had people call me back and later on saying they've got problems with memory or problems with having bad dreams and things like that. And although we don't know all the ins and outs of these vaccines, basically I tell them to keep a log and let your doctor know these things when they started happening, how often they're happening, because we don't really know in regards to that. But a lot of times, again, we have them wait 15 minutes when they get the shot. If they're going to have a reaction, hopefully within that 15 minutes.
And Dr. Boyd, did you get your slide?
I did, and now it just disappeared. Sorry, me as I pulled the slide up. Sorry. Yes. Okay. So the most common side effects from the vaccine are going to be, fever, headache. Some people do pass out when they get it. People get anxious about the whole injection process, but again, that's really not a severe outcome. The serious events that they mention are all because of the myocarditis, and again, they're quite rare, but there are no neurological side effects that are considered a significant serious event. And what Professor Moody said was absolutely perfect. And yes, the side effects do happen initially from a vaccine. The fatigue and the fever, the headaches that can come later, that's your body's normal immune response that is forming, which is what it needs to do to have an effective vaccine. Even if it doesn't have that response, your body is responding in the way that it needs to. But long-term side effects from vaccines are really not seen commonly. It's usually what happens right away.
Thank you.
Sorry, one quick thing. I get this question a lot. So I just want to mention real quick, the vaccine itself that's injected, it only lasts in the body for a few days. It does not last. The recipe that it's giving your body to create the immune response it needs, it goes away very quickly. It's broken down by the body. So it's not something that stays with you.
Thank you. So our next few questions is going to go into the guidelines for school about quarantine. So we're going to start with Dr. Bora. We're going to go right to the first slide, if you back up right, and talk about what the Kent County is recommending for quarantine guidelines in the school. And then we'll go right to Ms. Kim and Ms. Kristen to kind of speak specifically for GRPS.
So we are recommending that schools follow CDC and state health department guidance for schools. There's a little bit of a difference between what we are recommending and what our public health order, which is what's absolutely required. So there's a little bit of discrepancy there, but we do recommend quarantine for students who have been exposed. For students, if they're not fully vaccinated, we do recommend quarantine in that situation. And if both students are not consistently masked, they've been exposed, we do recommend quarantine in that setting. But we absolutely do require it for those who are household contacts or if there's an outbreak.
Thank you. Ms. Kim and Ms. Kristen, if you want to speak specifically, we'll go right to your GRPS slide.
Yeah, so we are, when it comes to isolation, I'll just start there because that's where this slide starts. We are still asking or requiring that students who test positive for COVID-19 stay out of school for 10 days. And the reason I know that the CDC guidance allows for students, for anyone to come out of isolation after 5 days, as long as they're consistently wearing a mask during that time from day 6 till 10. We just struggle a little bit with figuring out how to handle the meal times, breakfast, lunch, and we do have, quite a few students who have rest time during the day where they take their mask off for sleeping. So we have stuck with a 10-day isolation after testing positive for students. We are welcoming staff back, assuming that their symptoms are improving during day 6 through 10, because we do mandate and staff do have the option of, eating in isolation. So. And then as far as quarantining, we of course are following the public health order that requires quarantine if a student is living with someone who tests positive. As far as close contacts at school, we are recommending a quarantine and anyone who's identified as a close contact. Our nurses are still conducting contact tracing, and so those who have been identified as a close contact are getting notified that their student is a close contact, and we're recommending that they quarantine. But we aren't requiring that. We are allowing parents to make that decision for their students because we do have the mask mandate in place. I think that covers most of everything on that slide.
Thank you. Ms. Kristen, do you have anything to add?
No, not really. That pretty much sums it up right there.
Okay, thank you. We do have a question about if my child eats healthy and exercises, does that negate them from getting a COVID-19 vaccination? And also the second part of the question is related to if my child is immune compromised, does that negate them from being vaccinated. So we'll just go ahead and start with Dr. Bora with this question.
That's a good question that we hear a lot. And I think what we're finding with COVID is that people who can get very ill and people who have died are people who don't have underlying health issues in some situations, and also people who have been quite healthy. And so regardless of how, we want everyone to eat healthy and everyone to exercise well. So that's really fantastic, but it still doesn't protect people from getting severely sick from getting COVID or from long COVID. So I think, yes, I think everybody, regardless of how healthy you are, should get a COVID vaccine, but especially those people who have health issues or who have a suppressed immune system for whatever reason. It's especially important for them to get a vaccine and to make sure they get a booster if they're eligible for a booster, because they need that additional help for their immune system to recognize virus and to create that initial response, so that if they are exposed to COVID, they will be able to be healthier and fight off that virus. So the people that we see who are more likely to get very sick and to die from COVID are those who do have chronic health issues or reasons that their immune system isn't working as well. Thank you.
Dr. Mathis, can you speak to pregnancy in women being vaccinated and being, their systems being immune compromised as well?
Yes, we definitely have seen that in general, pregnant women are always more immune compromised than the general population. So otherwise healthy woman, once she becomes pregnant, is automatically immune compromised. And that's assuming she has no other health issues, she automatically becomes immune compromised. And if she has any other problems, then that just adds to her potential risk. So we recommend, and that's not just our office, but the American College of Obstetrics and Gynecology, the Society of Maternal Fetal Medicine Specialists, which are high-risk OB doctors, of course, the CDC, all recommend the COVID vaccination for pregnant women to help protect these women who are vulnerable in their pregnancy, because we kind of think that the reason why women become immune compromised is because we have a brand new baby in our body who is the foreigner. And so to help prevent our bodies from attacking the foreigner, our immune system is suppressed. Unfortunately, it's suppressed for everything. And so that's why we recommend the vaccination for all pregnant women. For many years, all of our regulating agencies and our societies have all also recommended the influenza vaccination, because before COVID came along, influenza was the big bad virus that would cause pregnant women to get extremely sick, so sick sometimes to be placed on a ventilator, and sometimes so sick that they would die of influenza. So we didn't see as many deaths when we had them vaccinated for influenza, which is why the recommendation is that every pregnant patient is always vaccinated for influenza at any trimester. So move toward to COVID. COVID, unfortunately, surprised us all by how severe disease can get in a pregnant woman. It was much more severe and much more wide-reaching to pregnant women than we'd ever seen because of the infectious nature of it. And so because of our information with COVID vaccination, we definitely have seen that COVID vaccination definitely reduces the severity of disease in our pregnant women. And that's why it's recommended for all of our pregnant patients.
Thank you. And then our next question that we have is related to, can my child have the flu vaccination and the COVID-19 vaccination at the same time? I'm going to go right to our school nurses, Ms. Kim and Ms. Kristen. Are you able to help answer that question?
I can take this one. Yes, the answer is yes. Yeah, we just consulting with physicians, the health department, and what we know about the flu vaccine and the COVID vaccine. It can be given at the same time. We always would tell parents or students, okay, they could have, their arm could be a little more sore, especially if they're decided to get it in the same arm. There's no harm though in doing it on the same day at the same time. They're not necessarily going to have more side effects because of that either. Everyone's a little bit different, but there's no safety concerns to do that on the same day. And we often, when we were in the partnering with Cherry Health and doing the vaccine clinics in the elementary schools, we did offer both. And we had many kids whose parents had them sign up to get both on the same day.
Thank you.
Mhm.
All right, Dr. Bora, so our next question has to do with, we want to kind of go through everyone about what do you want people to know about the vaccinations, but the first question that we have is, how would you counsel or advise parents who are on the fence due to the differing opinions of providers and other health professionals? So we'll go right to Dr. Bora and kind of talk through that.
Sure. No, I think it's really important for parents to feel really comfortable and confident in the decision they're making for their child. It's such a huge decision. But honestly, there really is no debate among healthcare professionals. I think all healthcare professionals of all specialties, public health and healthcare, all pretty much universally agree that vaccination is safe and essential in keeping individuals safe and the community safe. So I don't think there's argument between healthcare providers. I think all healthcare pretty much is universally supportive, but we do want to make sure that families and parents get the information they need so they feel really comfortable with that decision.
Thank you. And so what we want to do, because we only have a few minutes left, I want to go through each provider and clinician and talk about why it's important from your perspective for parents to be well informed and to have their child vaccinated. So we'll start with Ms. Stephanie Charles, and then we'll go to the school nurses, Ms. Kim and Ms. Kristen, and we'll go to our providers last. And so let's start with Ms. Stephanie Charles.
Okay, thank you. So in long-term care, I think that we have to remember that these elders are grandparents, maybe grandma, grandpa. So we are encouraging parents to have their children vaccinated so that they can come in and safely visit with grandma, grandpa, whomever, their auntie, uncle, whoever they are. So aside from keeping the child safe, it's keeping their loved ones safe as well. So that's the perspective that we're coming from. We want to be able to open up and have people come and visit and have picnics and enjoy their loved ones in just visiting one-on-one. But at this point, it's such a difficult area because people are hesitant to think about how the vaccination not only affects them, but affects their loved ones that are in our settings. So.
Ms. Kim, Ms. Kristen, from a school perspective.
I think a couple of things, as Dr. Bora mentioned earlier, that as many people as can get vaccinated is probably our best defense against future variants, showing up in our area. And then also, I think in order to keep our kids in school in person, we need to try to have as many students vaccinated as possible, both for their physical health and for our mental health and for their education.
Thank you. Professor Moody.
When I look at this as a community person, I think it's important that we stress the importance of them being vaccinated. Not only that they have all the information, and then that you give them a phone number. So if they have any questions afterwards, look, give me a call, or either we follow back up with them. How did it go for you? That way they can pass the word on to someone else. Yes, I took it, because they're going to ask me, did I take it? Yes. Did I have side effects? No, I didn't, but that doesn't mean you're not going to have any. So, and if your loved ones to come around, especially those kids, because you know how we gather together at all holidays, everything, it's important that they know that we want that to continue to happen, but we have to make sure that we're all on the same page. But again, give them that choice so they're not feeling like, if I don't, something's going to be wrong with me. No. But hopefully as they continue to go on and get information and get educated, they'll be willing to say, okay, it's important that I do get that shot.
Dr. Mathis. You're muted, Dr. Mathis.
Sorry about that. I agree with what everyone else has said so far in terms of reasons why to get the vaccination. And if there's any questions, by all means, contact your healthcare provider and discuss it specifically. So it could be a video visit, it could be an in-person visit. Definitely discuss your child's particular issues, if you have particular questions about your child's health, because every child is different, ask about that child's candidacy for the vaccination, and if there's any concern from the parent standpoint. And then from the adult standpoint, same thing. I recommend that you talk to your primary care provider or OB-GYN and discuss your particular candidacy and the benefits, because it's for the person's own personal benefits, but also, like has been discussed, we want our patients to be able to visit their family and friends. Some people have immune compromised situations for a variety of reasons, whether it's age, whether it be health problems, whether it be pregnancy. So the more people that are vaccinated, the lower the amount of virus is circulating in people's bloodstreams, the more helpful it is to prevent disease for other people.
Thank you. Dr. Bora?
I think my panelists had great points to make. As a parent, I was really excited to have my children vaccinated. And they were excited too, because they wanted to be part of something bigger. They wanted to help, we talk about COVID a lot at home. They wanted to help prevent COVID spread in their community. And so I think our children are aware that they're making a difference for others too. And so I want them to go to school. I want them to go to their activities, see friends, play soccer, and also help the community around us.
Thank you. So as you see on your screen, we have protect yourself and others. As the message has continued in this conversation, is make sure that you get a COVID-19 vaccine, and if you're eligible, get a booster. Another thing that we are asking is for the community to wear a mask, especially when you're in close proximity and within doors. Ms. Katie, can you go to the next slide? Social distance, which has been communicated throughout the pandemic, and trying to avoid crowds and poorly ventilated places. This is coming directly from the CDC. Ms. Katie, next slide, please. Test to prevent spread. So if you are going to gather with your family, make sure that you're being tested. And if you have any symptoms, make sure that you're talking to your provider and being tested as well. Make sure you have good hand hygiene, washing your hands often to prevent the spread of COVID. Next slide, Ms. Katie, please. And if you cough and sneeze, this has been a universal precaution, is making sure you cover your nose and mouth, and make sure that you disinfect areas that you're touching. Ms. Katie, next slide, please. So you want to monitor your health daily. Those are the things that we have asked. So you are an expert of your own health, and you should know that if you're not at your baseline, make sure that you report that. It could be a headache, a runny nose, a fever, a cough, shortness of breath. So any of those symptoms, please report to your provider right away. Next slide, Ms. Katie. We've talked about the mask guidelines, so we're going to skip this slide, and we're going to skip this slide too. And so if you want to know vaccination resources, here are a few from Kent County. We have also GRAAHI has COVID vaccinations, so you can go right to the site and you can register. Cherry Street Health, Spectrum Health, University of Health Michigan, West, Mercy Health, and local pharmacies. And if you do need some resources, whether it's transportation or asking more questions of how do I get to a location, just call 211. That is there for your support. I also put in the chat, if you will, please go ahead and complete our survey so that we can get feedback on future events. Any last words from anyone else or any other questions before we close out? It is at 10:30 now. Okay, so Ms. Katie, and I really thank you for joining this conversation. It was a great conversation, great questions. I appreciate all our providers on this call that took the time out to answer the questions from our community. So all the questions that we did receive has come from our community, and we wanted to address those questions so that parents will feel well informed to be able to answer questions for their children, for their family members, and then be able to have their child vaccinated. Ms. Katie?
Thanks so much for being here, everyone. And it's crazy times out there, so we really appreciate your time, especially all of our clinicians, but everyone who joined on today. Thank you so much.
Thank you.